Now, we've just done a few minutes with Dan using MirrorBox. I've called a break because what I want him to be able to do is to go away and basically continue to think about what it is that's been going on. He's got the direct sensory experience from what he's been doing with the hands in the box. He's been looking to me to a degree to contextualize some of that experience, and as you'll notice from the recording, I've pretty much been deadpan, not giving him a great deal of feedback. The rationale for not giving a great deal of feedback during the experience is I want him to go introspective with regards to what is happening. Think about the way that pain works. When something hurts, it grabs your attention. The difficulty is when you've got chronic pain, it just keeps grabbing your attention and it can become very miserable. When that pain doesn't go away because it's chronic, now the person has to learn to live with that. Often what they do is they become extrospective. Is it extra?
Yeah.
Lovely.
Often they become.
So often they become extrospective. So they keep paying attention on the outside and not on the inside. Now that's very common. Think about what you'd have to do if you had pain, how you'd live with it. Pain grabs my attention. So if my hand's getting too hot because it's on the radiator, the pain receptors fire off, I withdraw my hand. But if there's nothing that I can do about the pain, then I have to adapt and change the way that I think in order to live with it. The expression that Dan uses is he distances himself from the pain. Now, that's perfectly reasonable. He also keeps his attention on the outside, so he's a very good observer of things, and he looks at visual cues and feedback from me, the clinician. So, having got him introspective, giving him minimal cues, minimal feedback from myself, he quickly denies anything's happening. He's got an expectation set that says, I connect with the experience. So he puts the arm in, the phantom in, and then says, there's no connection. I can see the reflection, I can see what's happening, but I don't connect with the experience. At that point, I just stay silent. All I'm really going to do is wait. I'm just going to wait as long as it takes for him to stop looking towards me to contextualize what's happening, looking for me to give an answer. So he then goes back to looking at the mirror, and now he starts thinking about the sensory experience. As he explores that, of course, he starts to verbalize. The more he verbalizes, the more he's going introspectively. And so he now is in an introspective position to start making the changes. Now, he's now out there having a cigarette, having a cup of coffee. This is exactly part of the plan. Because now he's able to start to think about how does he contextualize to himself what on earth is just happening. And it's all about what is happening for him as opposed to him performing for me, the clinician. Never underestimate the client's or the patient's desire to please the physician rather than change or rather than heal. Most people want their doctor, their clinician, their therapist to think well of them, and often will change the reporting of their experience in order to please you. This is not what I'm after. I want him to change his experience to suit him. So, he's out there having a cigarette and coffee. We're going to call him back in. We're going to continue the session and pay attention to how little feedback I give him whilst he's giving me feedback on the experience. And I'll talk to you again shortly. How's that?